Good afternoon. My name is Johan Gruntling. I'm one of the intensive care consultants at Neom Hospital. I'm going to give you guys a very quick whistle-stop tour through blood gas analysis. This is very much based on the advanced life support course and how they teach blood gas analysis over there. And this is not an extensive analysis of how blood gas analysis should be done, but just a very basic introduction to get you guys started. The best way to learn this is to, after this, go see a patient, look at a blood gas and speak to someone about it and help and try to interpret it. So we're going to follow a 5-step approach in looking at blood gases. And the first, most important thing is to look at the patient. Ignore the blood gas entirely and look at the person in front of you. How are they doing? They will usually give you very good clues and tips as to what's wrong with them. Secondly, assess the oxygenation. Is the patient hypoxic? Is he or she well oxygenated? And look at the PO2 on the blood gas. Is it more than 10? Then that's usually fine. If it's less than 10, it's usually not so good. Very importantly also is to look at the oxygen saturations. 94 is our cutoff for normal currently. Then you look at the blood gas itself and you look at the pH. It'll usually be at the top of the blood gas and will give you an idea about whether or not the patient is acidotic or alkalotic. If the pH is less than 7.35, it's an acidosis. If it's more than 7.45, it's an alkalosis, and anything in between is normal. Then you look at the respiratory part of that calculation. If the CO2 is high and the pH is low, then you usually have a respiratory acidosis. If the CO2 is low and the pH is high, then you have a respiratory alkalosis. Remember, you can also get mixed pictures sometimes. And if the respiratory component, the CO2, is high, you have a respiratory acidosis. But if the pH is normal, it may be masking something else. And the same for the opposite. Then after that, you look at the metabolic component. If the bicarbonate is low or less than 22, or the basic says is less than -2, there is a metabolic acidosis. If the bicarbonate is high, above 26, and the basic says above 2, then there's usually a metabolic alkalosis. And that's the algorithm or the format that you need to go through to look at a blood gas. You can now do other things as well, just try to make that or hone in on the diagnosis of the patient. For example, you can do an anion gap calculation. This is a very simple calculation. It's the sodium plus the potassium minus the bicarbonate and the chloride. Normal values, 8 to 16, if you're using potassium as well. There's a differential to attach to this called MUD piles. It's an acronym, and it stands for metformin or methanol, uremia, DKA, paraldehyde, iron or INH poisoning, lactic acidosis, ethylene glycol poisoning, or salicylate poisoning. Importantly, though, is to follow the 5-step approach in trying to see and identify the reason for the acidosis. As an example, you see a patient in A&E in resus, and she's elderly and she's got abdominal pain. She's got a pH of 7.28, a CO2 of 5, a PO2 of 12, a bicarbonate of 14, a basic says of -6, and a lactate of 6. And you have to figure out what's wrong with this patient. Follow our approach. Again, the first thing is, what do you think is wrong with her by just standing in front of her? Does the abdominal pain represent a clue? Look at the oxygenation. Is she breathing okay? Her PO2 looks well on the blood gas. Secondly, look at the pH. Is it normal? No, it's low. It's 7.28. So there's an acidosis present. Look at the respiratory component then. What's the CO2? The CO2 is normal. There's no respiratory problems. And then look at the bicarbonate and the basic says. A basic says -6 means that you have an acidosis. A bicarbonate of 14 means the same. And the lactate of 6 gives you a clue. In the context of someone who has an abdominal pain and a lactic acidosis, could this be an ischemic gut? And that's how you do your decision making. Thank you very much. That's a very brief whistle stop into the interpretation of blood gas abnormalities.